So I'll start off this session introducing what we know about the relationship between cannabis and suicidal behavior. We know that both trends have been on the increase or on the rise over the last decade or so. Certainly, with the legalization of cannabis, there's become a lot more interest in it. Because it's classified as a Schedule One drug, the research obviously is far behind. However, the use is prevalent enough among youth and young adults that we can get some epidemiologic measures of associations between cannabis use and other behaviors, such as depression or suicidal behavior. And so, after I kind of introduce that topic, what I'll do is I'll move into a secondary analysis that we did within the National Comorbidity Survey Adolescent Supplement. This was a study of about 10,000 youth that was done in the early 2000s to really look at epidemiologic factors associated with the onset and severity of mental health disorders. And so it served very nicely for looking at the association between cannabis use and major depressive disorder, as well as cannabis use and suicidal behaviors, including suicide attempts. Within the National Comorbidity Survey Adolescent Supplement, I'll call it the NCSA for short. What we essentially did is we first looked at those who had cannabis use and those who did not. And this is lifetime cannabis use, so any cannabis use. And then looked at them dividing up, okay, so did these youth also have depression or not have depression? And what we found is that compared to adolescents who never used cannabis, those with lifetime cannabis use had a 2.5 times higher odds of having a major depressive disorder. So they were certainly more likely to have major depression, over 2 times more likely to have major depression. We also found that it was associated with severity. So if we took mild or moderate major depressive disorder versus severe major depressive disorder, what we found is that for those who used cannabis compared to those who don't, the odds of having mild or moderate major depressive disorder was about 2 times higher. And for those with severe major depressive disorder, it was about 3.32 times higher. And so we could see that using cannabis was also associated with not just the prevalence, but also the severity of major depressive disorder. It can be a bit of a challenge. So, one of the things that we run into with cannabis that we don't run into with other substances is through legislation, many jurisdictions, many states have given it medical status. Once you give something medical status, the general public tends to look at that and go, oh, well, it's safe, or oh, it can be used for these things that maybe science has not backed. So far, THC itself has not been found to be beneficial in mental health disorders, by and large, generally across the studies that have been done. And so generally what I'll do is I'll try and separate out. We're talking about THC-based products, which most plant-based products and concentrates are high in concentration of THC. That's kind of the first thing that I'll do. And then as I talk with them and kind of explore with them what their thoughts are and their experience, if you lecture these kids, they've been lectured by so many people, they kind of just shut it off. And so it's really having a conversation with them. Ideally, having a conversation using motivational interviewing to kind of discover their perspective and experience. People hear motivational interviewing and they're like, oh, I don't have 35 minutes to do therapy with this patient. You can do motivational interviewing in 2 minutes, 5 minutes. It does not have to be a 35-minute conversation. And so that's the tone that I try and set. And then explore with them, what do they already know about how marijuana or cannabis has affected them? What have they already seen in their life? Oftentimes, youth don't enter treatment because they don't connect the dots between their use and the problems associated with their use. And that's why motivational interviewing becomes an important strategy there, is because you're trying to help them bring those two things back together and understand that. And so the types of things that I would try and talk to youth about, especially if they have a comorbid mental health problem like depression, is that we know that cannabis use is associated with severity. It means that their symptoms could last longer. They could be more severe. They might be less responsive to treatment. These are the types of things that we think about when we look at severity as it's been associated between cannabis and depression. If they have any sort of suicidal behavior, suicidal ideation, We know that substance use in general, as well as cannabis use, as we showed within our study, is associated with increased likelihood of attempting suicide. When we talk with other professionals, one of the things that I talk about is when you're screening someone from a safety perspective, having active substance use problems is one of the things that can help distinguish those who have suicidal thoughts from those who will then act on those thoughts. And so it really becomes important in those moments to screen for active substance use and then to have a brief intervention around their substance use and at least educate them and offer them resources around, hey, if you do this, you're more likely to hurt yourself. And you're telling me you have these thoughts of suicide, but you don't want to hurt yourself. This is one of the steps you could take to keep yourself safe. And it doesn't mean they're going to stop, but they're generally receptive to that kind of messaging because it's centered on them and it's centered on their goals. I don't want to hurt myself. I want to feel better. Okay, if that's what you want, these are some steps that we could take to help you get there. After we looked at the association of cannabis and depression, we then looked at cannabis, depression, and suicidal behavior all within the same model. And so the suicidal behavior was the outcome. And we looked at suicidal ideation and suicide attempt and suicide plan. And then within each of those models, looking at that, we regressed onto that, the sociodemographic factors like age, gender, ethnicity, and then we included cannabis and whether or not they had depression, mild or moderate or severe, within the same model. What that allows us to do is speak to the association between cannabis use and suicidal behavior after accounting for the fact that they have major depression or not. So I'll give you two examples from that data. The first one, when we looked at lifetime suicide attempt, after accounting for whether or not they had a major depressive disorder, those who had used cannabis in their lifetime were 6.9 times more likely to have attempted suicide in their life. So nearly 7 times more likely. That's pretty significant. By comparison, after accounting for cannabis use, those with mild to moderate depression were 4 times more likely to have attempted suicide, and those with severe depression were about 14 times more likely to have attempted suicide. And so you can definitely see that depression has a significant role, especially severe depression is a major driver of suicidal behavior. But cannabis use is not an insignificant factor associated with suicidal behavior in youth. We saw similarly in the past 12 months. So when we look at just past 12-month use, past 12-month suicidal behavior, similarly, we see that after accounting for having a major depressive disorder within the past 12 months, cannabis use is associated with a 3.7 times higher odds of also having attempted suicide in that time frame. When we're more temporally related, depression probably has a more significant role. Mild to moderate depression was associated with about a 7.9 times higher odds of having attempted suicide, and severe depression was associated with a 36 times higher odds. So temporally related, obviously, depression plays a very significant role in suicidal behavior. So the other thing that we looked at in this study was when we looked at frequency of cannabis use and its association with suicidal behavior. And the way that we did this is we divided it down to less than monthly, about about a day a month, up to 1 to 2 days per week, and then 3 to 4 days per week or more, which is it's pretty regular use. And when we look at those who have attempted suicide, or when we look at suicide attempt as that primary outcome, what we see is those who use 3 to 4 days per week or more, they had an 8.7 times higher odds of having attempted suicide. Even those who used less than monthly, it was still almost 5 times. It was 4.9 times higher odds. And those who used in that middle range was about 6.8 times higher odds. And so when we look at what we can colloquially call like that dose effect, whereas exposure goes up, the outcome goes up, that lets us know that, oh, maybe there really is something here because we're seeing this effective dose increase in terms of the behavior. And so those are just a couple of the things that I would share from this study.